Welcome back, Rangers. This is part 2 of the First Aid Skills Merit. So let's get right into it. You can look back on your First Aid Skills Merit. This is going to be page W2 or 2, and we're going to be looking at point number 6. So we're going to be talking about weather-related emergencies. The first weather-related emergency we're going to go over is hyperthermia. Now, before we get into that, let's actually go over two different kinds of words. And we used one of these words before. We said hypovolemia. So these two words are hyper and hypo. These are prefixes that can determine what the state of an illness is. So hypovolemia means a loss of fluid. So hypo is a decrease or loss of something. Hyper is an increase of something. Now, when we're talking about weather-related emergencies and we discuss hyperthermia, thermia meaning temperature, hyper meaning an increase, that's going to mean our patient's basically overheating. So hyperthermia is when you have an overheating patient and they can't cool themselves down. Now, there's two conditions that hyperthermia can cause, and this is heat exhaustion and heat stroke. In order to tell the two differences between these two conditions is, one, for heat exhaustion, they're going to be conscious. These patients are going to be awake. They might be irritable, but they're going to be awake. And then the second, heat stroke, these patients are going to have an altered mental status. They might not be aware of what's going on, or they could be unconscious. Now, this is very, very bad, as you might think, for the body to have, and we need to cool them down rapidly. For hyperthermia, we want to cool a person as rapid as possible to stop them from overheating. And there's a couple ways you can do this. You can use tempered water, room temperature water, or a little bit cooler than that. You can use a fan, or you can use cool packs under the armpits or in the groin area. So those are some ways that we can rapidly cool somebody, but the main thing is we're going to want to remove them from the hot environment that they're in. Once you stop the heat source that they're in, then you can begin cooling them down. So the second condition or weather-related illness that we're going to go over, some of you might have heard it, is called hypothermia. Like we said before, hypo means a decrease in something. Thermia is their temperature, so this is going to be a decrease in temperature, and that's going to be a cold injury. So cold injuries that we can have are frostbite or frostnip or other freezing extremities. And this is essentially when your core body temperature drops below 95 degrees Fahrenheit. Now, you got to keep in mind, because these patients are very, very unstable. When you have a patient that is in a hypothermic state, their heart is very delicate and can go into a lethal rhythm. So we want to be careful when moving them. It's almost like we're treating them as a spinal injury patient. We don't want to move them unless they're stuck in a cold environment that we can take them out of and bring them into a warm environment. That's the only time we want to move these hypothermic patients. Now, the first sign of hypothermia is actually shivering. Once you begin shivering, your body's already at a colder state and you're trying to bring your core temperature up. And our first way to do that is through shivering. So once we find a shivering patient, we're going to want to give them some clothes or remove any wet clothes that they may have and replace them with dry clothes. Now, the further in a hypothermic state that you get, you become aggressive and you become altered and you don't really know what's going on. This can cause the patient to become aggressive, so you might need to coerce them and help treat them, and tell them that it's going to be okay and that you're there to help. Another way to help them from losing heat is to create a hypo wrap or a hypothermia wrap. This is where, let's say we're in a camping setting, you put them inside a dry sleeping bag and then wrap them in a tarp or survival blanket. Remember, just for wind. And this will keep them from losing any more heat. If you have hot packs, you can also throw the hot packs in to generate some more warmth. Now, there's a common misconception when you're dealing with a hypothermic patient in where you would do what's called body-to-body warming, where you would get into the sleeping bag with the hypothermic patient in order to treat them and stop them from going further into hypothermic state. Research has shown that this is actually not good for both parties and will only decrease the non-hypothermic patient's temperature and will not help the hypothermic patient. So you're not going to want to do any more body-to-body heating. Now let's move on to our next point, which is number 7, and this is going to be dealing with somebody who's choking. So now, a choking patient, essentially what they have wrong is that they have something blocking their windpipe or their trachea, and they can't move air up and down. Now, some signs that you're going to see on a choking patient is, 1, they'll probably be holding their neck, looking like they're distressed, or 2, maybe pointing, or 3, not breathing. Now, it's a common misconception that choking patients say, I'm choking, I'm choking. True choking patients can't actually talk, so they won't be able to say anything to you. Now, once you stumble across this patient, you're going to want to encourage them to cough. Try and get them to expel their own dislodged object, as this may move it around for them to get some air in. If not, then we're going to have to perform the Heimlich maneuver. To help us out with that, we have my dad, Gary. So there's a couple different steps you're going to want to do for the Heimlich maneuver. First, you're going to want to get behind the patient. You're going to want to stand with one foot in front of the other in case they do fall behind you, or if they go unconscious. Now, in order to actually do it, we're going to make a fist with one hand and cover it with the other, and we're going to place that right above their navel. So, under their arms, make a fist, cover, and right above their navel. And from here, we're going to start giving abdominal thrusts. Now, I'm not actually going to do it because that'll actually hurt, so you can have a seat. So to give the abdominal thrusts, what we're going to want to do is squeeze or pull upwards and inwards. And we're going to do that 5 hard times rapidly, with a pause in between each thrust. And hopefully that'll create enough pressure to remove the object from their trachea. Now, if it doesn't, we're going to have to continue with the abdominal thrusts. Now, after 5 thrusts, we're going to want to re-examine our patient to see how they're doing. So you can ask them, hey, can you breathe? Did it dislodge at all? Can you see the object? If not, then we're going to continue with another 5. So 1, 2, and so forth till we hit 5. And if it doesn't again, can we look? If they're still in trouble and they wind up going unconscious, we're going to switch to a different approach. So if you could lay on the ground, please. So now your book is actually going to say to do something called abdominal thrusts while they're laying on the ground. This is no longer recommended, and it is not the treatment for a choking patient who goes unconscious. What we're going to have to do for a choking patient that goes unconscious, like we said, not abdominal thrusts, we're going to do chest compressions. Now, in order to do chest compressions, you fold your hands together like this, place them on the center of the chest, not the abdomen, the chest, and you're going to perform 30 compressions, pushing down, and hopefully that will create enough force to dislodge the object. Now, your book is also going to say to do something called a finger sweep. This is also something we are not going to be doing, as if you don't see the object and you do a finger sweep, you can push it in deeper, and that can cause further harm or just put it right back where it was. So, after each compression, or we're going to be looking in the mouth, open your mouth. So we're doing compressions and we're looking, and hopefully we're seeing this object come out. And if it does, then we can grab it. Only grab it once you see it, but do not do any finger sweeps. All right, you can hop up. So that's the Heimlich maneuver and how to do it on an unconscious patient as well. So next, we're going to be going into other types of injuries, and this is kind of where we get more into the bleeding and the trauma care. So the first injury that we have, this is going to be a cut. Now, simple cuts, most of you know what a cut is. Most of you have probably had a cut. If you've fallen or been whittling and accidentally sliced your finger, that can cause a cut. Now, cuts can actually be serious no matter what the size is, especially in a camping setting, which we mostly are in. And if you don't address them, they can lead to infection and other serious injuries. So we're going to want to address this as soon as possible. And the way to do this is we're going to have to clean it with soapy water, soapy warm water, if it's on our hands. If it's on any other part of our body, we can still use soapy warm water. We just have to scrub it and get it clean. Now, we no longer use disinfectants like alcohol or hydrogen peroxide because that can disrupt the cell membrane in there and can slow healing. So we just want to use some soapy water to get rid of all the germs. Now, once we've cleaned it, we want to take another sterile dressing. This can be gauze, trauma burn dressing, anything, anything that's sterile, because we want to keep a sterile environment. So we're going to pat it dry, and then we're going to take a dry sterile dressing, such as a Band-Aid, like this, and we're going to put some ointment on it. Now the ointment we want to use is a triple antibiotic ointment. This could be bacitracin or neosporin, but anything that's a antibiotic ointment. Now this is going to keep, germs from creating an infection and getting further into your skin. So what you do is you open this up, you put it directly onto the Band-Aid, not on the person, because you don't want to contaminate it. And then once the ointment is on the Band-Aid, then you can apply it and then monitor it for the rest of the camping trip. So that's how you treat a simple small cut. And this is part 2, actually. We've run out of time, so meet us in part 3 for more wound management.
In the silence you won't let go. In the questions your truth will hold. Your great love will lead me through. You are the peace in my troubled sea. Whoa, you are the peace in my troubled sea. My lighthouse, shining in the darkness, I will follow you. Oh, my lighthouse, I will trust the promise. You will carry me safe to shore. Tomorrow brings. With each morning I'll rise and sing. My God's love will lead me through. You are the peace in my troubled sea. Whoa, you are the peace